Classification of drug. Now we are going to see about the second part. This is about the classification of drugs. It includes site of action, chemical structure, mechanism of action, ionization of drugs, therapeutic uses, anatomical therapeutics classification. Here now we are going to see definition of essential medicine according to the WHO, World Health Organization. Medicines that satisfy the priority healthcare needs of the population. They are selected with due regard to public health relevance, evidence on efficacy and safety, and comparative cost effectiveness. Intended to be available within the context of functioning health system at all times and in adequate amount in appropriate dosage forms with assured quality and adequate information and at a price the individual and the community can afford. That is known as the essential medicine. Some of the medicines are included in this list which can be available easily and at a cost friendly atmosphere. That is known as essential medicines. In 1977, first model list of essential drugs along with the dosage forms and strengths by the WHO. 2017, 20th list with 433 medicines including 25 FDCs. 1996, National Essential Drug List in India, that is revised in 2011, and in 2015 National List of Essential Medicines with 376 medicines including 20 FDCs at primary, secondary and tertiary levels. Essential drugs or medicines according to the World Health Organization's criteria. First criteria is adequate data on its efficacy and safety should be available from clinical studies. We need to get the data evidence for the use of the medicine which was safe, which is safety and efficacy. It should be available in a form in which quality including bioavailability and stability on storage can be assured. Choice should depend upon pattern of prevalent diseases, availability of facilities and trained personnel, financial resources, genetic, demographic and environmental factors. If two or more similar medicines, choice should be made on the basis of their relative efficacy, safety, quality, price and availability. Cost benefit ratio should be a major consideration. Then, coming to the nomenclature of drugs, they are divided into three: chemical, proprietary, non-proprietary. Non-proprietary means it is or generic name or approved name or official name. Proprietary means or brand name or trade name or commercial name. These are the three nomenclature of the drugs, which means the chemical name or nomenclature, then the generic name and the brand name. Some examples of chemical, generic and brand names are given below in the tabular column. We can discuss first one. Acetyl salicylic acid is the chemical name of a drug and it is commonly known as aspirin with its generic name and which has a brand name of Disprin. So second drug is acetaminophen, that is a chemical name and its generic name is paracetamol and its brand name is Crocin, Calpol, Metacin, Dolo, etc. And third one is aminobenzyl penicillin, which is known as by its generic name as ampicillin and its brand name is Procillin. Here it is the classification, means not classification, it is a route of administration of drugs. It is mainly commonly divided into two categories, that is systemic and local. Local means it is applied in the local area for it is further which includes in the local are skin, topical, intranasal, ocular, mucosal, throat, vagina, mouth, ear and inhalational and transdermal. In coming to the systemic, it directly enters into the blood circulation. It is further classified into enteral or parenteral. Parenteral means the injection that will be coming under the parenteral, and enteral means which will pass through the GIT. Enteral includes oral. The examples of enteral route of administration are oral, sublingual and rectal route. Coming to the parenteral, it is divided into inhalational and transdermal injections. It is further classified as intravenous, intramuscular, subcutaneous, intraarterial, intraarticular, intrathecal and intradermal. So this is the route of administration classification. First one, enteral. It means through gastrointestinal tract. It includes oral, sublingual and rectal routes. These all comes as enteral. So this is through the GIT tract. Then parenteral. It means through routes other than the enteral. That is other than the gastrointestinal tract. It includes all type of injections and inhalations. Local. It includes administration of a drug at the site where the desired action is intended. It includes topical administration in oral cavity, gastrointestinal tract, rectum, anal canal, eye, ear, nose, bronchi, skin, intraarterial, injection in deep tissues, etc. Example, joints. So this means local, the site where the medication or the drug is needed, or the site where the infection or any issues happens. For that, we are administering in that place is known as local administration. So these are the examples for local administration. And coming to the systemic administration, it includes drug administered to enter the blood to produce systemic effects. So systemic effects, to produce systemic effects, we are administering drug through the systemic routes. Oral, it means drugs taken by mouth. Example of oral route of drug administration are tablets, capsules, syrups, mixtures, etc. And intravenous, it includes drug injected directly into the bloodstream through a vein. It may be administered as bolus, slow intravenous injection, or an intravenous infusion. Intrathecal, it includes drugs injected into the subarachnoid space. Example, spinal anesthetics like lignocaine. Then intra-articular, it includes drugs injected directly into the joint space. Example, hydrocortisone injection for rheumatoid arthritis. Subcutaneous, it includes drugs injected into the subcutaneous tissue of the thigh, abdomen and arm. Example, adrenaline, insulin, etc. These are administered through subcutaneous. Intradermal, it includes drug injected into the dermis layer of the skin. Example, tuberculin and allergy tests are done by this method. And intramuscular, it includes drugs injected into the larger muscles such as deltoid, gluteus maximus and vastus lateralis. A volume of 5 to 10 ml can be given at a time. Example, paracetamol, diclofenac. Intraosseous, it includes injecting a drug directly into the marrow of a bone. That is known as intraosseous. Transdermal, it is in patches. It includes administration of a drug in the form of patch or ointment that delivers the drug into the circulation for systemic effects, and also it can be used as a local site for local application. So here rectal, it includes administration of drugs in the form of suppository or enema into the rectum. Sublingual, in this case the preparation is kept under the tongue. The drug is absorbed through the buccal membrane and enters the systemic circulation, bypassing the liver. Example, nitroglycerin for acute angina attack. Bypassing the liver means it is first pass metabolism is not going to take place in this sublingual. Inhalation, it includes volatile gases and liquids which are given by the inhalation for systemic effects. Example, general anesthetics are given by inhalation method. Then endotracheal, it includes a catheter inserted into a trachea for primary purpose of establishing and maintaining an airway to ensure adequate exchange of oxygen and carbon dioxide. This is done in the severe cases. So this is the diagrammatic representation of the route of administration in different form. Ocular means it is administered in the eye. Inhalation means it will be taken by nostrils, and oral means by mouth. Sublingual or buccal means also mouth, under the tongue, etc. And buccal means in the mouth itself. Then transdermal patch, it can be acted locally and also it can be enters in the systemic circulation also. Then this is epidural and the rectal. Then comes here topical administration, then otic, and then parenteral, that includes IV, IM, SC that we have discussed before. So this is the pictorial representation of various injectable routes: intravenous, subcutaneous, intramuscular, epidermis, dermis, subcutaneous tissue, muscle with vein. These are the representation how to administer the injections. So this is the route, absorption pattern, advantage and disadvantage. First comes the oral. Absorption variables affected by the many factors. The oral route of administration is affected by various factors that involves, for example, gastric emptying time, digestion process, etc. That they all can influence the oral route. of administration. Advantage: safest and most common, convenient and economical way of route of administration. But the disadvantage comes limited absorption of some drugs. Food may affect absorption. Then patient compliance is necessary. Drugs may be metabolized before systemic absorption. The disadvantages are sometimes the patient, if they are not in the conscious, they can't be able to swallow, or they can take this in oral route. That's what the disadvantage of this oral route. Then comes intravenous absorption not required. Advantage: can have immediate effects. The intravenous route of administration will provide the immediate effects, and also the bioavailability will be 100%. Ideal if dosed in large volumes. Suitable for irritating substances and complex mixtures. Valuable in emergency situation. Dosage titration permissible. Ideal for high molecular weight proteins and peptides. And the disadvantages is unsuitable for oily substance. Bolus injection may result in adverse effects. Most substances must be slowly injected. Strict aseptic techniques needed because they should be sterile. They need to be sterile because it directly enters into the systemic circulation. Then subcutaneous depends on drug diluents. Aqueous solution, prompt depot preparations, slow and sustained. Then advantage of subcutaneous is suitable for slow release drugs. Ideal for some poorly soluble suspensions. Disadvantages are pain or necrosis if drug is irritating. Unsuitable for drugs administered in larger volumes. Intramuscular depends on the drug diluents, aqueous solution, prompt depot preparation, slow and sustained. The advantage of intramuscular are suitable if drug volume is moderate, suitable for oily vehicles and some irritating substances, and preferable to intravenous if patient can self-administer. The disadvantage are affects certain tests, creatinine kinase, etc. Can be painful, can cause intramuscular hemorrhage, avoided during anticoagulant therapy. Transdermal, it has an absorption pattern of slow and sustained, and the advantage is bypasses the first pass effects, convenient and painless, ideal for lipophilic and poorly bioavailable drugs, ideal for drugs which are quickly eliminated. And the disadvantages are some patients are allergic, causing irritation. Drug must be highly lipophilic, may cause delayed delivery to the site. Limited to drugs which can be taken in small daily doses. And coming to the rectal, the absorption pattern is erratic and variable, and the advantage is partially bypasses first pass effect, bypasses destruction by stomach acid. Ideal of drug cause vomiting, ideal in patients who are vomiting of comatose. And disadvantages are drugs may be irritate the rectal mucosa, not a well accepted route. It is not a well accepted route. Then inhalation, the absorption pattern is systemic, absorption may occur, it is undesirable, and the advantages goes absorption is rapid, can have immediate effects, ideal for gases, effective for patients with respiratory problems, dose can be irritated, localized effects to target lungs, lower doses can be used, fewer systemic side effects. And coming to the disadvantage of inhalation route, most addictive route, drug can enter the brain quickly, and the patient may have difficulty in regulating dose. Some patients may have difficulty in using inhalers. And the last one, sublingual, depends on the drug. Few drugs have rapid direct systemic absorption. Most drugs are absorbed incompletely and erratically. This is the absorption pattern, and the advantage is bypasses first pass effect, bypasses destruction by stomach acid. Drug stability is maintained because pH of saliva is relatively neutral, may cause immediate pharmacological effects. This also produces immediate pharmacological effects. And the disadvantage of sublingual route is limited to certain types of drugs only, and limited to the drugs which can be taken in small doses, and may lose part of the drug dose if swallowed. Now going to, so the next topic is about agonist and antagonist. The word agonist and antagonist can be used in different contexts. They are entirely two different words. So first, knowing it before this, we need to know about the receptors. That will be discussed in later classes. So now just we can see what is agonist and antagonist. Agonist means the receptor for which it activates the drug that occupy the receptors and activate them is known as agonist, and the drug which occupies the receptor and does not activate them is known as antagonist. That means these two words have an opposite action, that is known as the agonist and antagonist, which we can discuss in later classes. That's all for today.